So let's review the results from the latest Dental Post 2026 Dental Salary Survey report. So this is data from 2025 that they're now reporting on, and I always find a lot of value in this, even if the survey set is relatively small. So let's jump over to the dental hygiene section here, and this report is for all roles, including dentists. And so I'd encourage you. We've given you the link here to download this report and really review this yourself. So we're going to take a couple minutes to look at some highlights of the dental hygiene section of this. Okay, so what we see here is just a snapshot of the respondents. So there were about 2,600 hygienists that answered this survey. And so just keep that in mind as you go through this. A relatively small subset, but what's interesting is it is confirming some of the trends that we're seeing when we're talking to practice owners and dental hygienists and office managers alike. So one of the things that we really appreciate seeing is satisfaction with their current roles. But before we get to that, one of the things that I want to talk about is tenure within the current practice. You know, I've been in dentistry for 35 years. I graduated from dental hygiene school in 1991. And, we've certainly seen, especially in the last 6 years since 2020, we've seen shifts in longevity with dental practices. And I think it comes from both sides. I think it comes from dental hygienists making moves because of culture or pay or lifestyle. Also, we see a lot of hygienists that are moving closer to home. If they were driving quite a ways, for a practice, they're moving to somewhere that's closer to home so that they can have more time with their family. We're seeing more hygienists that are requesting fewer than full-time hours. But the other thing that we're seeing here is in 2024, if we look here in this tenure with current practice, in 2024, 57% of the respondents had been with their practice for 0 to 6 years, and in 2025 it was 55%. So a slight majority have been with the practice less than 6 years, and then the remaining is 7+ years all the way up to 20 years. And there is a good percentage of respondents that have been with their practice for 20 or more years. I think it's really interesting too as we go through this to really look at this work status here, full-time versus part-time. One of the things that we're seeing as a trend, and where this is confirmed in this report, is to really be flexible when you're looking to hire a hygienist, because the term full-time may immediately cause someone to move on to the next ad. So even if you're looking for full-time, we recommend unless you're just dead set on that and you're not open, which we wouldn't advise, we would advise you to be flexible and maybe remove that term and just say, we're looking for a fantastic hygienist to, work within our practice, and other descriptors about your practice. We have a resource on the Inspired Hygiene website under our resource guides that is called 17 Tips to Attracting a Hygienist. And I would encourage you to check that out. It's still very relevant. But be flexible. Know that you might end up with 2 fantastic hygienists to fill 1 full-time role. And that is really where we are right now. And I would encourage you just to really embrace that, and just to set really clear expectations with those hygienists that might be working part-time in your practice, that when they're there, you really want them to be part of the team, and you treat them like part of the team, even if they are part-time. So I think we're seeing this, I think we're going to see this shift to even more higher percentage of part-time. Okay, so now we talk about satisfaction in current jobs. And I think this is really important to see, like, relationships drive fulfillment is at the top of the list. I want to talk about autonomy defines the quality of work, right? Hygienists do crave control in their roles and having autonomy over clinical decisions. One of the things that we really work to develop with our clients is helping the team members have autonomy within boundaries, right? So it's not in your patient's best interest to have every hygienist doing something differently with regards to when patients move from recare into periodontal therapy. But you can create clear standards for your practice and then create flexibility in decisions within those boundaries, right? So it's not the dentist telling the hygienist how to treat every patient or approving every treatment plan. I mean, obviously, the dentists are confirming the diagnosis. But as long as we're all working within these confines of this common standard of care, then the patients are going to experience that continuity of care. And I think that's really, really important. This is really great. Just what lights hygienists up. I love seeing this. My employer treats me like a partner. That's what we preach, right? Is create diagnostic partners on your team and treat them as such. Really empower them to be an extension of you. And what are the things that really wear them down? Toxic workplace dynamics and unrealistic expectations. So I'd encourage you to really read these, take these to heart, and think about how this might impact or affect your practice. I loved this is that 73% of hygienists received a pay raise within the last 2 years. I don't think that surprises any of us. Very few have received a pay raise. And I think that is going to continue to narrow as hygienists see what their options and opportunities are out there. Over half responded that they're very satisfied. They're satisfied or very satisfied with their total compensation. I'm happy to see that. This is really big. This is really what caught my eye is that 73% of the respondents said that they plan to remain in their current role for the time being. This is good. This is good for the stability of the job market, good for stability of practices, but don't take this for granted. I think it's still for all of your team members. It is very important to continue to stay competitive with benefits, with culture, with compensation, and continuing to give your team members opportunities to advance their clinical skills and how they are expressing their career and their role within your practice. So I'm just going to let you review some of these when you download this, but there are some key things to really pay attention to in this report. Just looking at different employment patterns, there are a high number of respondents within this set of the survey that are planning to retire within the next 5 years. I think it was 28%. So just be proactive with your planning on that. One of the things that we teach, that we've learned from so many of our colleagues and that we really believe in too, is always be recruiting for all positions in your practice. And, just be upfront with your team is like, look, we're always looking for amazing people to join our practice. If we find someone fantastic, we may find a way to work with them. And if not, maybe if it's not today, it's in another year. So, just make sure your team knows, like, when they see an ad on your social media, or they see an ad for a role, online on Indeed, it doesn't mean that you're necessarily planning to release somebody or, anything's wrong. You're just continually looking for great fits to your practice. And I think that is really a key to growing practices and modern practices, because there's always transition within a dental practice, right? Whether it's somebody moving, whether it's someone that wants to cut back days, someone that's assistant that's going to hygiene school, you just never know when those things are going to come up. But we've also seen this with our clients and the dental practice owners that we talk to, is that the job market is starting to restabilize. Does not mean that it's not still difficult, but it seems to be more stable. Compensation continues to need refinement as, it matches with practice needs with regards to profitability. There's going to be veteran hygienists that are nearing retirement. So again, always be recruiting, building relationships with your dental hygiene schools, right? Anywhere within a 2-hour period, 2-hour drive from your practice, like, start to build relationships there, see how you can support them, and really be flexible when you're seeking team members. So hope this is helpful. Download the survey. You'll see it's for every role in the practice. I think you'll find a lot of insights here.